It's been almost a year since Saskatchewan began its vaccination efforts. And since some regions of the province are having more success than others, to help us sort through the latest trends, reporter Guy Kenville joins us now. Guy, I understand this issue of low vaccine uptake is in some pockets of the province came up yesterday during the latest COVID-19 media briefing. What can you tell us about that?
Well, Fiona, there was an interesting moment yesterday when Dr. Shahab, our chief medical health officer, offered some rare insight into one particular community's vaccination effort. Generally, we don't know how specific communities are doing well or not vaccination-wise because the province only breaks down their vaccination numbers according to 13 broad regions. So when Shahab yesterday singled out a particular community, it was a surprise.
And I'll give a shout out, for example, to Melville, where 85-90% of the eligible population is vaccinated. So even within a specific geographical area, some communities have done really well, some communities not so well.
So if you take a look at this list, Regina comes in at the top with 82% of eligible people fully vaccinated. The Northeast and Saskatchewan regions aren't far behind at 80%. The Central East, where Melville is located, has 78% of its eligible population double dosed. And at the bottom, some northern regions are below 70%, with the far northwest at just 61% of eligible people fully vaccinated.
Okay, well, let's take a closer look at some of those regions with the low uptake. What demographic has the lowest turnout?
If you look at the far northwest, in every age category except for elders aged 80 and over, the far northwest has the lowest vaccine take-up. Among eligible teens, only half are fully vaccinated, for example. I guess the good news there is that relative to other regions, the far northwest has a small number of active cases right now, only 31 cases. But if you look at the top 5 regions right now in terms of active cases, there's one that really pops out for all the wrong reasons, and that's the Southeast. It's the only region where the 4 youngest age categories are still hovering in the 60% take-up range. 69% among eligible teens, for example, and even lower at 65% among people in their 30s.
So do we have any sense why these regions in particular have a lower vaccine take-up?
Yeah, Fiona, researchers at the University of Saskatchewan recently published a study about this, actually. It gathered over 9,000 responses from May of 2020 to April of this year, so it only captured about half of our vaccination drive. But what it showed is that factors such as lower education levels and financial instability were linked to an increased likelihood of vaccine refusal and hesitancy. It also found that because of generations of traumatic experiences within the medical system, Indigenous people are less likely to be trusting of the healthcare system and of government initiatives in general.
So, Guy, what do we know the province is doing to address these challenges and improve vaccination rates in those areas?
Yeah, they've talked a lot in the past about going door to door to tout the benefits of vaccines and about the importance of doctors promoting getting your shot. But in one point yesterday, Shahab talked about how it might be possible to use some negative experiences during this pandemic and turn them into a positive. Here's what he had to say.
Obviously, many communities have been deeply impacted in this fourth wave, especially communities with low vaccination rates. Everyone seems to know someone who was hospitalized or died, and that's very unfortunate. But that again has increased interest in getting vaccinated, but then it's important that, especially in remote, isolated communities, vaccines are made available, and if there's ongoing questions, those are addressed in a timely way.
But beyond that, Fiona, I didn't really hear anything specific or new there when it comes to tackling these low vaccination rates in certain areas. We're expecting vaccinations for kids aged 5 to 11 to begin soon after Health Canada approval, of course. And those clinics, we're told, will be open to unvaccinated parents as well. But as Shahab made clear yesterday, those people should just go get their jabs now.
Well, thanks for this, Guy.
Of course, anytime.
That's the CBC reporter Guy Kenville in Saskatoon.